Welcome to the Java Cafe, Java fan.
Good morning, everybody. Good morning. Good morning. Okay, the unmute is off. I got everything all set. Good morning, everybody. You are tuned in this morning. I know a few people are like, wait, what? Today's Friday, Jimmy. You are here for a special brew this morning. I was just talking with our guest, and I want to say it's been 5 years because I would want to believe that we started with ASG, who I want to thank for this opportunity. I think it was 21. So 4 years, 2 years with Jason. And I'm excited today to have back Audrey, who is the executive director of the Mass Health Connector. Sometimes we say Health Connector, and so I might fluctuate between the two. I do this almost every day, but today it is vital and it is important that we share this information with community. So do me a favor, hit that share button very quickly. If you're watching on Twitter, retweet this. If there's someone that you know was recently laid off, if there's someone that you know is an entrepreneur, as a matter of fact, before we bring our guests in, we just want to sort of remind you of one of the developments that we shared. It's actually, you all, I keep this here because sometimes when I need to take a break, I remind you that this is available, especially to our entrepreneurs, and healthcare or health insurance is available to everyone. And so we're going to bring our guests in right after this commercial, and we'll be right back with you.
For the innovators, the dreamers, the risk takers, independent workers who keep our neighborhoods thriving, ConnectorCare from the Massachusetts Health Connector has plans for every lifestyle and budget.
Having access to affordable healthcare is for everyone in our community.
ConnectorCare plans help more people save on healthcare that covers all their needs. Find out if you qualify for ConnectorCare. Visit mahealthconnector.org or call 1-877-MA-ENROLL.
Now, I might get in a little trouble because that was last year's commercial. So I'll talk to them and maybe we can get an updated one, or I can actually change the graphic myself. But without further ado, I'm excited to have her back in the Java Cafe. Let's say hello and go in the comments and invite Audrey Morse and Gastier,
yep.
Good morning. Good to see you in the room this morning. Again, thanks for being back with us.
Thank you for having me, Jimmy. It's so great to see you and to be back.
I am glad to have you here. And as I said, this is something that Health Connector has been very intentional about the last 4 years of you and Jason coming into the space. Healthcare, health equity, awareness of information is a staple in the Java Cafe. So I am glad to have you back to share this very important information. At least once a month, Audrey, I show that commercial. So it's not, unfamiliar to the audience. And it's just something, we thank you also for supporting a Black-owned business, you know what I mean, in this partnership. And so, Audrey, first I have to ask you, it's been a year, a lot going on, economy affects insurance. We learned the last time that you care about people. This is not just a job. I have to ask, like I do the mayor and the governor, How you doing? How are you?
I'm doing all right. Thanks for asking. This work is intense. It is so important. So my colleagues and I wake up every day just energized to make sure that people across Massachusetts have health coverage. It's not a topic people get excited about necessarily unless something comes up for them. But it's just so important that people have that protection so they can get to the doctor if they get sick. To take care of their health proactively and preventatively. So it is a busy, busy time in public service and in health coverage and in healthcare right now, but it is so energizing to get to do this work. I appreciate you asking that, but I honestly feel like it's a privilege to get to do this work and make sure we're getting people what they need all around Boston, all across Massachusetts.
Absolutely. And we want to remind folks, this is definitely statewide. We're Boston centric here. Well, going a little bit regional in the Java Cafe. But I want to, you said this is a busy time. And, if you've been employed or have had to apply for insurance in different times in your life, some may be familiar with this term, open enrollment.
Yes.
Can we talk about what is actually the Health Connector's open enrollment? This is open enrollment season, like typically across the world. It's either this, and we may get into it, or a life-changing circumstance. We talked about that a little bit last year.
Yeah.
So what is open enrollment, Audrey?
Yeah. So first, let me kind of describe what the Health Connector is, and then I think open enrollment might make a little bit more sense. So the Health Connector is the state's official health insurance exchange or marketplace. So sometimes you might hear those terms used interchangeably. And what that means is we're the place where anybody can come who doesn't already have health coverage through some other way, right? Whether that would be because they're on another program like Medicaid, called Mass Health here in Massachusetts, or Medicare, or coverage through the VA or their job. So the connector was really designed to be kind of the catch-all for coverage for people who don't have coverage in another particular way. We cover about 350,000 people across the state of Massachusetts. That's the highest level of enrollment we've ever had before. So a lot of people in Massachusetts need us or are coming to us for health coverage. So we cover a lot of people. And open enrollment is the time of year when anybody who doesn't already have coverage can come on in, explore what options they have available to them, and enroll in a plan. And they don't need any what's called like a qualifying event or a life change event. Sometimes you might hear those terms. So that means that anybody, like, you don't need some reason, like you've just lost your job or you've just lost another type of coverage or you got married or had a baby. Anybody can come on in. It's open enrollment. Now, I'll say a little bit more about that, but other times of the year, just so people know, there are other ways you can get in. You can have one of those life changes, or in our program, anybody who newly qualifies for a subsidized health insurance product can come in at any point in the year. But open enrollment is when you tend to hear the most about the Health Connector, hear the most from us, because we're all around the state, in communities, on the radio, on TV, on bus ads that you see while you're waiting for your bus in the morning. And that's because this is the time we really want anybody who doesn't have coverage to come in. There's a lot of support and information available for people for how to do that. Now, open enrollment began on November 1st, and it runs through January 23rd. But there's a really important date coming up next week, which is December 23rd, or that's the kind of lead up next week to the 23rd, which is the following. And December 23rd is important for people to keep in mind because it's the date by which you need to pick a plan and make a payment if you want your coverage to kick in for the first of the new year. So you can head into the new year with the peace of mind of having health coverage. So December 23rd is a huge date for us. So all the work we're doing between now and the 23rd is really kind of full tilt out in the community, trying to raise awareness. So that's why we're really appreciative you had us on today, Jimmy.
Absolutely. And let me ask just for one point of clarity. I wondered when I saw the update, we're going to talk about ConnectorCare and some other things in a second, but we talked about this last year, and I think with Jason as well, is that, there's this air of, new year, new you. We're actually going to incorporate that theme next year. So we'll remind folks to make sure they apply for the January, but we're going to talk about ConnectorCare, but is the 23rd is the ability to make a payment and also have insurance for the first. And that happens during open enrollment season. And also if you have a qualifying life change.
Yes.
That may not be the exact term, but I mixed them, I think, there.
Yeah.
And so it doesn't end on the 23rd. I see this new January 23rd date, which is kind of the same as the 23rd. Is there any difference? And I don't want to jump around, but it was a question I had, and I've talked to you all 4 times, so I know the audience may have it as well.
Yeah. It's a great question. So the only difference is just about when you need that coverage to start. So for most people, if they want to start the new year with coverage, we tend to think of a January to December cycle for health coverage. So just starting the new year, having it all lined up for January 1st, take that action by December 23rd. But if you miss the boat, something happens, or if you're not losing coverage until January, and you're not going to have a gap, and starting on February 1st is okay for you, then that January 23rd deadline is perfectly fine. So no big difference. It's just for most people, we see kind of want to take care of this on an annual basis. So that's why we're particularly loud and out there for that December 23rd deadline.
One of the things that you kind of touched on, Jason mentioned it, and we talked about it more last year, one with the commercial and just, our state and those officials being sensitive to the different needs of those that need to be insured. And so can we talk about some of the updated general eligibility and how folks can manage costs? And then there's a little bit of a difference, maybe with ConnectorCare, but that's why we're here, so we can get the education and information. And so how can folks, who's eligible, and how can folks manage costs?
Yes. So anybody who lives in Massachusetts is, lawfully present here, a resident of Massachusetts, can come and get health coverage through the Connector. And one of the things we really like to push out the messaging around is how much help there is available to lower the cost of that coverage. When we talk to people who are uninsured, they often say, oh, I know I need health coverage. I know it's important, but I don't think I can afford it. In Massachusetts, most people who apply for coverage through the Health Connector will qualify for help lowering the cost of their monthly premiums and their co-pays, when they go to the doctor, what do they maybe have to pay? And that's largely done through a very special program we run called ConnectorCare. And we've had it in place for over 15 years. It's a really powerful program that takes federal Affordable Care Act subsidies and kind of boosts them with additional state investment to make the cost of coverage come down even lower for people. So we've had that in place for a long time. That's where most of the people we cover are covered. And what's really exciting is that last year, with thanks to the governor and the legislature here in Massachusetts, we expanded who qualifies for that program, for that help through ConnectorCare. So it went from people who it was up to 3 times the federal poverty level, is sort of like the insider technical term, to 5 times. But just to put that in real terms for people, that means someone earning up to about $75,000 a year, or a family of 4 that's earning up to $156,000 a year can qualify for this program. What's important for people to know about that is incredibly impactful help for people that makes the monthly premium low. Many people have no premium, but for folks who do have a premium, it's much lower than you would pay, out of pocket, if you were on your own in the insurance market, or even in some cases through a job. And this coverage.
Can I chime in for 1 second? Because one of the things, again, that we keep referring to our guy, hi, Jason, and you as well, is I remember one time we had a very intentional conversation. I think we discussed it with you last year about the subsidies, about, there's a presumed demographic of those that would take advantage of this resource. And you can be unemployed. You can be an entrepreneur. You can be a head of household with a family.
Yeah.
Can you just give us a little bit about the importance of, and Audrey, I'm sorry, I can't think of another word outside of, sometimes people may not want to take advantage of the resources available. You know what I'm saying?
Sure.
Can you just tell people that ConnectorCare is Health Connector is not it's everyone can apply.
Everyone.
And I remember you all have said that. Don't not apply. Everybody apply.
Absolutely.
Because the potential of you getting some subsidy in these days, Audrey, $20.
Yeah. It matters.
Yes.
100%. No, I'm so glad you went there, Jimmy, because I do think a lot of folks think like, oh, that's not a program for me, right? For whatever reason, they might just think who they are, what their life experience has been. We cover every single type of Massachusetts resident. We have entrepreneurs. We have self-employed attorneys. We have, a single mom of 2 kids. We've got everybody under the sun at every income level, by the way. There's so many reasons why somebody might need health coverage from an exchange or a marketplace like the Health Connector. If that's true here in Massachusetts, that's true across the country. That's what the Affordable Care Act and health reform initiatives like this were about. There's so many types of people who fall through the cracks in the health coverage landscape, people of all different types of means and circumstances. And so we definitely try to focus on different types of communities. When we go out there, you can see in the ad you ran, like thinking about people who are self-employed and entrepreneurs and gig workers. But there's so many types of people demographically, in terms of how they make a living, where they live, city, rural, you name it, every age. We cover everybody. I mean, you cover 350,000 people in Massachusetts, you're going to have all types of people. So it's really important people don't make the assumption, that's not for me. I wouldn't qualify for anything. I'm not the type of person that program is for. We're for everybody. We're here to make sure Massachusetts is at as close to universal health coverage as possible. So for anybody listening, if you don't have health coverage, if a family member, a friend, a neighbor, a colleague doesn't have health coverage, we're the right place for people to come.
Yes, Audrey. I just want to let folks know that the phone number is here. And also, if you want to type in the website, or some of you mentioned you take screenshots, there's the information. We're going to share the link on all of my socials later. But also, I want to let those of you know that you may jump in right now and may only have a few minutes or take a break. We have hyperlinked the information and the website in the comments. And so as much as I want you to stay here, If you need to apply right now, everyone is encouraged to apply and apply today. Those are the two messages that we want you to walk away with today. And as Josephine, hi, Miss Josephine, inquire, call and see. I like that. Inquire, call and see. All right, Miss Josephine.
I might take that.
One of the other things I wanted to ask about is a clarity, and we've shared it here, but can you just reiterate some of the sensitivity that, you know, if you call or if you're on the website, that folks, how they can apply through the website, through the phone? Are there different languages, you know, to support people? And so the website is here, you guys, but Audrey, let us know exactly how folks can apply.
Absolutely. So the website is there. I know you've got it listed. So that's how a lot of people take care of their application. You can come online, start an application, encourage people to do that sooner rather than later. So if you have any questions, you can get those taken care of before the 23rd. We also have a call center, so you can call us and ask for help. And we've got all kinds of language supports on there, so people can call 877-MA-ENROLL. But I also want to take a minute to talk about a really special resource we have all across the state, which is called the Navigator Program, Navigators.
That's right.
And they are the best. They are positioned in communities all across Massachusetts. They might be in a community health center. They might be in some other kind of community-based organization. These are folks who are trained to assist people with the process of getting through an application and just staying on top of their coverage needs as they go forward. So their name is really apt, right? They're navigators. They help you navigate what can be a complicated and kind of overwhelming process, right? Filling out the application, it takes a minute. And, you know, there's questions you might not have bumped into before. The navigators are trained to help make the whole thing really smooth and easy. They've done it a gazillion times. They know their communities. They speak, I think it's 34 different languages. So we really encourage people, especially if you're doing it for the first time and you feel a little bit overwhelmed, reach out to a navigator in your community. They really are the best. They can sit down with you in person. They can also work with you over the phone if that's your preference. You can find a navigator by going to our website, which is mahealthconnector.org. And there's a tab that says Get Help up on that top bar. And you can pull that down, put in your zip code, indicate you're looking for a navigator, and it'll pull up navigators in your community. So I really can't overstate how helpful these resources are. And again, they're all across the state. They speak dozens of languages, and they really, particularly for people who are going through it for the first time, just a tremendous resource. We always hear the most glowing things about our navigators. We really adore them.
How, you know, and it's so interesting because we've had a couple of navigators on the show before, and they're just, and I actually, in one of your partners, we had a health navigator on that was more of an outreach worker. And so when they came on, Audrey, when they came on the show and they said they was a health navigator, I set them up with all the questions and context for a connector navigator. And she was looking in the screen like, baby, that's not what I do.
Different thing.
Connect them to other navigators. And so you all have, you know, taken ownership of that term. But I want to make sure, again, that folks know that in the comments, whenever there are resources and when we can, we always put a hyperlink in the comments. And so there's the general information that's hypered there, and also to get information about the navigator. Audrey, do you mind if I ask you a couple of general questions?
Of course.
One was, hold on for 1 second. I seen it from Heidi Ivy, who is an entrepreneur like myself. And I know a lot of folks may have this question. Do I have to reapply if I already have Mass Health?
Nope.
You don't.
You're in Mass Health. Nope. I mean, open your mail from Mass Health. If they send you stuff that says you need to do anything to, you know, complete a renewal or anything like that, then obviously do that. But there's no need to sort of keep reapplying if you're already covered in whether it's Mass Health or whether it's the Health Connector. So just, you know, make sure you're opening the mail and messages from that particular program, but there's no need to reapply.
The other one here is I have Medicare and WellPoint. Would I be eligible for this? Auntie Java. The way you find out is how, Audrey?
So folks that are eligible for Medicare are not the population we cover, right? So that's kind of a separate part of.
I had a good setup there.
I'd love to, but no, Medicare is its own universe. But if folks have questions about, you know, any interaction, or particularly, you know, for people who are approaching Medicare eligibility age and they're in connector coverage, they can reach out to us, and our call center, our navigators, and others can support people with that transition.
One of the things that you said made me think of something we've discussed before is, and I've seen it, unfortunately, when I've had to take advantage of some resources that the state offers, you Google something and, you know, if I'm doing it younger, Mr. Internet savvy, some of our seniors will as well. And so I still every now and then get the crazy texts to go through these third party folks and whatnot. One of the things that I saw your face. Can we talk a little bit about those applying, being especially online?
Yes.
And, you know, being very careful because there are predatory insurance brokers.
Yes,
out
there are.
I don't know if that's a term, but
yeah, no, it is. And it's real and aptly described. So that's why it's really important for folks who are looking for us or looking for coverage. You come to our website, mahealthconnector.org. Don't Google, you know, health coverage in Massachusetts or, you know, anything really generic or general, because sometimes what will pop up in your search results are actors that are selling things that are not real insurance or not compatible with state law or, you know, federal Affordable Care Act consumer protection standards. We do encounter people who thought that they were enrolling in a Health Connector product, but weren't, and were in something that was kind of a junk insurance product. And they find out when they go to the hospital and they end up with a claim that's not covered. And they're just really heartbreaking situations. And we always work with those folks and pull in, you know, the Attorney General's office and the Division of Insurance and others. But it's really important. That's one of the reasons we do so much outreach like this, is to make sure people know our name, they're coming to our website. So there's no risk of confusion or falling into a plan, being sold something that's really not what people are expecting or thinking or you know, counting on for health coverage.
Absolutely. I have another question, and you're going to see a little something here, Audrey. Ma, the way you find out is you go to Health Connector, but this is my mother, so any information you can give her.
I love it. Oh, hi, Mom. So one of the things I probably should have said earlier on that's great is the Health Connector and Mass Health actually share an application and an eligibility system. So even though, you know, I'm the Health Connector, I'm out talking to people about Health Connector coverage. When you come to the Health Connector's website and start an application, it will determine whether you belong in Mass Health or in the Health Connector. So that's true if you apply for financial assistance. So you can come to our website and start that application. We also have a tool on there called a Get an Estimate tool. And I believe that will also say for people, like, actually you would belong in Mass Health, and this is what that would look like. So typically, just to kind of get at the kernel of that question, like where that cutoff happens in terms of income, it actually depends on different populations. There's some populations that at the exact same income level, because of immigration status or something, would be with the connector rather than Mass Health. So it depends on who the person is. So your kind of particular circumstances would dictate where you would fall. But sort of lower income folks would typically land in Mass Health, and then kind of low to moderate income tend to land in ConnectorCare. But it's important to do that application or call a navigator, work with a navigator to see what your particular circumstances would look like.
Absolutely. I wanted to just reiterate as we get ready to wrap up. If folks have general questions, please let us know in the comments. But I just wanted to reiterate a couple of things. One, it is open enrollment, but in the case of Connector, it is open enrollment anytime there's a life-changing experience. And the best time to do it is on as late as or before the 23rd if you want to be eligible for on the 1st of the next month.
Yes.
Ideally, you know, you want to have a health insurance coverage period, because that also plays into a easier tax filing later on, just to be very honest. And so ideally all the time being insured, but if you're not now, let's aim for the 1st of the year, the 23rd of this month. ConnectorCare this year, however, am I right in saying it's been extended, or is it still that it's been extended specifically for ConnectorCare?
Yes, it has been, and it's been expanded for ConnectorCare as part of a 2-year pilot program. So we're entering the 2nd year of it. And that means people earning up to about $75,000 a year for an individual, $156,000 for a family of 4. So we're really reaching into middle income folks here, can qualify for ConnectorCare for their 2025 coverage. Again, it's a 2-year pilot, so we'll have to see what happens going forward. But that is money on the table for folks right now to make sure that their healthcare bills are lower. So we want to make sure people are coming in, signing up, so that they can get those savings and make sure they have that health coverage and that peace of mind as they head into the new year.
Absolutely. Audrey, may I ask you just, I don't know if I ask if you're a mom, parents, family, care about community, but just why, I know there's the cost, but what are the other benefits?
Yeah, I'm glad you asked. And I am a mom, and I think a lot about this, right?
Yes.
So there's a lot when we think about health coverage that's about, just making sure you're not caught off guard if something bad happens, right? Even for those of us who think, oh, I'm pretty young, I'm pretty healthy. You just never know what could be coming around the corner. And we hate to see instances of people who end up, with medical debt because, they had an accident or they got sick. Nobody plans to get sick. Nobody plans to have an accident. And health coverage is really there to make sure that does not throw you off your game from a financial perspective at any age in life, right? As you're starting out, later, all that. So that's a really big part of it. It's really important for people to know the health coverage we provide through the Health Connector and in Massachusetts is really comprehensive. This is coverage that is going to have your back on making sure you're getting preventative care, that you're getting regular checkups, that you get screenings to catch cancer early. All those kinds of investments that we've made in having that coverage be there for you before you get sick to prevent you from getting sick all the way through if something really, catastrophic happens and you end up hospitalized. And we've been thinking a lot in Massachusetts and at the Health Connector in recent years about how do we make coverage even more impactful for populations we know have worsened health outcomes compared to the general population. So as an example, talking about ConnectorCare, a few years ago, we made the decision to eliminate copays, any copays or cost sharing for prescriptions or services associated with diabetes, coronary artery disease, asthma, because we know that communities of color bear a greater burden from those types of conditions. Yeah. And we don't want a copay for you to go pick up your prescription or go see your doctor to be a barrier to you having that chronic condition taken care of. So we want people to think about health coverage as something that will be a backstop if something bad happens, but it's also there to keep you healthy, make you healthy in the first place. And there's a lot of thoughtful kind of program design that goes into making sure that we're really meeting the needs of exactly the kinds of populations we have here in Massachusetts that deserve health, that deserve financial security, and be there for them when they need it, have their back.
It goes back to, what I said in that message in the commercial that everyone deserves healthcare.
That's right.
You know what I mean? And that health equity piece there. And thank you for naming that intentionality that the Health Connector did around, a lot of the disproportionate impact on, communities of color. You know what I mean? And so and I saw a different energy there. You started to talk about that. So that and why the insurance, the mom and the advocate came out. She said, yep. I have something scrolling down here because when you were talking, a thought came to mind just in something I saw during our correspondence. And what it's saying is enrollees frequently report feeling relief after learning how affordable the coverage available to them is and being able to get the care they need. One thing that I thought about in reading that is some of this coverage also includes behavioral health. And you talked about the health and the physical health, period, neurological system, a mental psychosocial system. I don't know. But that stood out to me because what that statement says there is that there was a mental wellness, which we know contributes to overall health. Can you just talk about the important, you talked about the other thing was the screenings. I'm sorry, you just got me a little excited about, some spaces with this because we know that people fell behind in screenings during COVID, and behavioral health is something that is very important. Can you talk to both of those a little bit deeper about the screenings, and then behavioral health can be covered?
Oh, yes, it has to be covered. That's the law in Massachusetts. And there's so many kind of laws and policies that I feel really grateful for that we have here in Massachusetts, and thanks to the Affordable Care Act, that say mental health is health, that is healthcare. So all of our products include comprehensive mental health, behavioral health services, substance use disorder services. So it's really important people understand that's not a separate thing. That is all a part of this. That's all a part of protecting your health, all of it. So that is real. And then to your point, there's sort of the psychological benefit of having health coverage, just knowing, we know a lot of folks live paycheck to paycheck. So there's all sorts of things they worry about. They worry about their car breaking. They worry about, an increase in rent. The last thing you should be worrying about is if you got sick and you'd have to focus on getting well, and that takes up a lot of mental energy, you shouldn't have to be worrying about whether you're going to be able to afford your healthcare bills or going into debt because of, hospital stay, et cetera. So just having that be one less thing that people have to worry about is a really important part of how we think about health coverage in Massachusetts and through the Health Connector. So that's immense. And then to your question about screenings, you're absolutely right. People did fall behind during COVID. We also know that lower income folks who we think about a lot when we're thinking about our ConnectorCare population, we can see in data at the state that even for insured lower income people, they're often less likely to go to the doctor, even when they're covered. So they're using that coverage as like that, true insurance, like just in case something really bad happens, but not necessarily taking advantage of the fact that, again, under the Affordable Care Act, preventive care is free. If you're covered, you're not going to be charged a copay to go and get a recommended cancer screening. So we want to make sure all populations up and down the income scale, no matter where you come from, no matter your community, that you're taking advantage of those free preventive screenings. And we see, we collect a lot of member stories and feedback about coverage because it's just important to us to hear from people like, we cover 350,000 people, but that's not just 350,000 data points. These are real people's lives. So one of the most, fulfilling things we do is collect actual stories from people about what coverage has meant to them. And I read one just this week that was somebody who hadn't been able to afford coverage before, got into ConnectorCare and got a cancer screening and found out that she had cancer. And she's well now and doing better. But she said, if I had kept sitting out of coverage because I thought I couldn't afford it, I wouldn't have caught this. And it's scary to think about. But the inverse of that is like we can prevent people from being in a situation like that. And that's why it's so important that people have that health coverage, that they get it before there's an issue, and that they stay on top of those kinds of preventive screenings that they're entitled to. And we need people to have to stay healthy.
Absolutely, Audrey. I thank you for, we have our, sort of bulleted information that we wanted to share with community. But I always think it's important when folks come on, and especially in your role as the executive director, we know that there are often some communities that we're talking about. The medical industry has not always treated them right. Mm-hmm. And it's important for people to know, those that are at the helm of facilitating this stuff, that it's not just a job. You said something like that earlier. Mm-hmm. And so I really appreciate your candor with us this morning and keeping it real. We've seen a little bit of the mom and the advocate come out as well, but this is just so important. And I'm saying this in these interesting times when there are a lot of potential changes around healthcare policy. Mm-hmm. You need to get in now while the getting is good. I just heard my grandmother. Okay. But I just wanted to reiterate, Audrey, one, thank you for coming and spending this time with us. We know that we're getting ready to go into the holiday season. Hopefully you're having some time with family planned and some downtime for yourself as a part of that mental wellness we talked about. But there is the number, everyone. And I know our seniors tend to often call more, so we want to make sure we have the number. That's also probably a little bit of an easier access if you need some diversity in language. But if you want to go to the website and go to this website, and what I want to do, matter of fact, if you're going to go to the website, what I prefer that you do, and if you're going to do it now, just to be even more sure, because Audrey and I talked about there are, what did I say? Predatory insurance brokers, which is easy. Click from here and don't do Google. But another way, Audrey, that folks can be sure is if at a website, and I don't know if the fraud people have picked this up yet, but HTTPS is a little bit of, we're not saying trust every HTTPS, but I'm just saying, I just wanted to put that out there because I'm very sensitive to our seniors. I block people on Twitter if they look interesting, so they don't mess with my, because my mother's on Twitter. All right, so let's get back to the information, but I just, my seniors, I got to look out for them. And so don't forget, everyone, first of all, if you're going to apply today. Yeah. It's recycled every 23rd on or before the 23rd of the month if you have a qualifying life change, which includes starting a new, losing a job, having a child, getting married. If you have a question, call and ask just to be sure. And then the pilot program for the ConnectorCare is in its second year, and you can apply for that all the way through January 23rd, 2025.
That's right.
I'm tired, Audrey. That's always an indicator that it's a good, interview.
Good.
Did we get everything?
I think we did. And just thank you so much for really lifting this topic up and kind of cutting to the core of what it's really about for folks. It's a real pleasure to talk with you, and just so appreciate you giving visibility to this work.
Yes, ma'am. And I would say it's back at you because the cutting to the core of what you did beyond you know what I mean by the technical of the technical of this, and getting to the core of the humanity of why we need to be intentional about taking advantage of these resources. And especially when it comes to screenings, you can get your diabetes medicine and no copay. And so apply is the message. That's so right. Audrey, thank you. I want to say happy holidays to you and yours. If we need to figure out a little quick check-in or something, or if you want to get me another video to just remind folks on ConnectorCare for the January 23rd date. But, if not before, same time, same place. And we're going to put you on regular schedule for next year, like on the Wednesday, our We Need to Know Wednesday, and we'll make you a staple every third Wednesday in December.
You're so kind. That sounds fantastic. I will look forward to it, and just a real pleasure to be on with you. Thank you for the work you do, Jimmy.
And tell my guy, and tell him Jeff, and he'll start laughing. Tell Jeff that Jalen says hello.
I will relay that message.
All right, Audrey. Thank you.
Thank you so much, Jimmy. Take care.
Thank you.
Bye.
Listen, folks, it is imperative that you take advantage of the information that Audrey and I just discussed and go either call 1-877-MASS-ENROLL or go to the website. And remember, direct website, don't Google, because there's high risk of you going to the wrong website. I did once. And I still get texts and every now and then about, you need to apply, you need to do this. And sometimes they ask for a lot of your personal information. And so be very sensitive to that. And this is not just our seniors. I know of a teenager in the last few months that they got him good and had him download an app and took control of his phone. So, well, actually not a teen, a young adult. But anyway, I'm going to get off of here, everyone. Today is Friday. I saw some notes. Auntie Java was in the room. Sharon Cornelius is in the room. Javon is in the room. Naraki, good morning to you, beautiful. Donna Williams Bowen. Hi, Janky. Good to see you in the room this morning. Hello to the folks over that popped in for a few seconds on Instagram. Red Glasses Chick. And Nikki is over on Instagram. My mother popped over there for a second. I seen Helena from Meet Austin on over there. Sister Debbie, good morning to you. Good to see you in the room. And I thought I saw something from Auntie Java about UC. And Auntie, you're like me. It's UC now. It's not UCB. But UCB celebration was great. Got to hug. Dr. Brandy was there. Oh, need to tell y'all next week. Guess who's in the Java Cafe on Monday, y'all? Dr. Brandy Brooks is coming in on Monday for Mental Health Mondays. This Monday, she's going to check in with us for the end of the year and just let us know what's going on. She traveled for the holidays, so she's going to have a story as she talks. So she will be with us on Monday. On Tuesday, a shot of Java. On Wednesday, Mayor Michelle Wu will be with us. On Tuesday, we will have guests from Harvard's HIV program. As you all know, World AIDS Day was on December 1st. Logistics and some things, we weren't able to work it out for them to come on leading up to World AIDS Day. So they're coming on Tuesday, the 17th. I think I have all the dates right, y'all. And then the 18th is the mayor. And the 19th, I'll let y'all know. But we have some great programming planned for you next week. We'll update you about some time off from the last week in December. We will have no programming. I've been encouraged to do that once a quarter. I made it twice this year. One was because of the surgery, not by choice. And so just letting you know that we won't have live programming probably from the 30th, not coming back until January 6th, which is in itself. I'm not even going to go there. Dr. Brandy will be back, yes, Ma, on Monday. Thank all of you for being here. I got Sharon. I wish I had, but well, Sharon, go and apply. Please go and apply. I'm somewhat pissed. First of all, Sharon's saying pissed. I'm somewhat pissed. My insurance cut me off. Eye care at Demic. They said your insurance no longer is covered. We have to cancel your appointment. So that's probably a provider thing. And this thing of in-network, Sharon, a lot of the companies garner rates and things with their providers. And so you probably have to switch your eye care provider. And you probably couldn't apply for free care at Demic if you wanted, because there's something called continuity of care in healthcare. If Sharon's been with that eye doctor, ophthalmologist, or optometrist there at Demic for 20 years, it's not fair that she has to switch because they're no longer a preferred provider from the insurance. That's what it's called. I used to do insurance officer for behavioral health of all areas. Yeah. And so I have some context. Ma says she has well care and I'm still covered until the end of the year. So Ma, make sure you check. You see, you all get an hour today. You all racked up points these last couple of days, an extra hour today, the event last night. So that's it for me, everyone. We're going to get ready to wrap up. I do want to close today, as you all see. Well, you can't see it right now, but we're in the holiday season and the tree is in the corner. Decorations are out. I'm going to actually unfold it. I have a fake tree. Do the little branches and do it. It's just, because once you get started, it can be a 3-hour project. And I can't start it and stop. And so the tree's coming up. But with that being said, I wanted to just share just a little snippet with you all from a video that we're going to show in its entirety leading up until Christmas. But as you all know, last year we had the Christmas show at the public broadcasting network, one of the local ones. And this is not going to do what I need it to do because it's not queued up. So next week we'll play Christmas music. All right. That's it for me, everyone. Happy Friday. Have a great weekend. And again, Monday, Dr. Brandy will be with us and we'll let you know about other programming in addition to Harvard's HIV programming coming with us on Tuesday and the mayor on Wednesday. And that's it. All right. I caught up with all my comments. I said good morning to everyone. And I think we're good. Miss Josephine, it was good to see you in the room this morning. And y'all have a great weekend. And we will talk to you on Monday at 10 a.m. Love you too, Ma. And that's it, y'all. Just trying to see if I had any music queued up just to close out on this Friday. I don't. So we'll see you all on Monday, 10 a.m.